Thank you, Dr. Quiros. As Dr. Quiros said, my name is Angela Spinella. I am the practice manager of the Pediatric subspecialties here at Valley Medical Group. We're going to go over some of the items that you're going to see, some changes that we put in place to make sure that you have a safe visit for yourselves, your family, and for our staff here at Valley. So the first thing that I want to show you guys is our Athena Portal. So the Athena Portal is really easy to use. We can push information to the portal for you to review with your child, with your spouse, about your child. If you want to set up a portal, just ask one of our staff members and they will help walk you through it. You will be registered as a relationship to the to the patient. We normally don't do patients registered for themselves because most of our kids do not have email addresses. So it always is the patient's parents' email, and we'll put that into the system and you guys can access their chart. So as Dr. Quiros said, we opened our practice back up on Monday, June 1st. For those of you who may be new to our practice, we are at 140 East Ridgewood Avenue in Paramus, not Ridgewood. I promise you, if you go to Ridgewood, you're going to end up the Pancake House. Enjoy yourselves. But if you want to come to our office, it's 140 East Ridgewood Avenue in Paramus. You will see right next door to our building is our new Valley Hospital. You'll be able to see it going up, and it's going up very quickly. So it's a really cool site for your children and yourselves to take a look at. Just follow the pediatric patient parking signs, and that will get you to the direct parking lot that you need to be in. We're going to review some of our in-clinic visit protocols and all of our safe protocols we put in place for you guys. If you want to schedule an appointment, please call us 201-447-8151. That's going to lead you to a phone tree, and you can select the provider that you're looking to see. If you don't hear the one that you're looking for, just select any of the options, and any one of our staff can help support you. So one of the newest things that we've kind of implemented at Valley is what's called car chat. This helps to keep you safe by keeping less people in the building and in the waiting room. So the idea of our visits now is not to have you sitting in the waiting room for a long time. It is, all right, hang out in your car, let us know that you're here, and then we'll ask you to come in, have your temperatures taken, and then we'll allow you upstairs. So this is an idea of what it will look like. It'll ask you to put your child's first name and first initial of their last name. So I would be Angela S. And then it gives us information that we know it's you. So we take your enterprise ID, Athena department, and then we can make sure that it is the right child that's coming here. As soon as you clicked I am parked, one of our staff members will reach out back to you saying, okay, we're ready for you, or okay, stay in your car. It's going to be another couple of minutes. Again, this is our way of keeping you guys safe and out of the building. So that way we have less people, less interactions happening in the office. So the next thing I'm going to show you is a video. It is our new clinic arrival process. It starts with an introduction from myself, just to kind of welcome you guys back. And then I'm just going to talk through some of the protocols that we have in place. Hello, my name is Angela Spinella, and I am the practice manager of the Pediatric subspecialties here at Valley Medical Group. Our mission is to enhance lives by healing, caring, and inspiring wellness. During these trying times, we've had to do this from afar by offering telemedicine visits with our patients. We are now ready to welcome you all back to our office. For those of you who have been loyal patients with us for years, you will notice a few changes to the practice. The video you're about to see will show the steps we've put in place to ensure a safe visit for you, your family, and our staff. While we are committed to ensuring a safe environment, we will do so while maintaining a fun and comfortable environment for all those who come to our office. If this is your first visit with us, we hope that you will remain with us for years to come. We thank you for being patient and understanding while we work through this. We are in this together. Thank you very much, and I can't wait to see you all soon. So what you are currently seeing is a patient and her parent walking from the pediatric parking lot. So they have just received the text message to join us in the office, and they are making their way in. The first thing you see when you come in is our signage as far as where you're going to go. But of course, most importantly, is our hand sanitizer. So as soon as you walk in, you're able to take your sanitize your hands. We have changed this a little bit where we actually have on the first floor a temperature stations. So that way you don't even have to go into the elevators. We want to make sure that we do our temperatures as soon as everyone arrives in the building and then send you up to your location. Our next video shows the screening process. This is very similar to what you will see on the first floor or third floor, depending on what, if in case you park in the wrong area, what the staff will be doing to make sure that you are safe to enter the building.
Hi, how are you today? Good, how are you? Good, thanks. My name is Anne, I'm one of the nurses here. I'm going to have you guys stand behind the line and tell you how we're going to proceed. Who are you here with me? Dr. Cameron Dyson. Okay, great. So I'm going to ask you a few questions. These questions might be similar to what someone had already asked you, but we just want to make sure we're being safe. And then I'm also going to take your temperatures for both you, Mom, and your daughter. Okay? You can come forward. And what is your name?
Emma Smith.
Okay, and your date of birth?
May 11th, 2007.
Okay, great. I'm going to start off with your temperatures.
So as you see, our nurse Ann is sanitizing her hands, putting gloves on. We always want to make sure that we keep you guys safe.
You're matching masks.
And we always want you guys to feel like you're still part of our family. So we're still going to interact with you like we normally would. We'll ask you, you know, if you've had a birthday recently, we'll ask you how that's been. And then you'll see that the temperature monitoring that we're doing is touchless. So that way we don't, you know, you're not, if you're scared of us touching you, don't worry, it's a touchless scanner. We will go through the triage questions the day before your visit as well, just to make sure no one has any symptoms.
These are going to apply to both Emma, yourself, anyone else that lives in the house or that you've had close contact with. Has anyone been tested for COVID-19?
No.
Okay. And in the past 14 days, I'm going to go through some symptoms. Let me know if you've had any of these. Any cough, shortness of breath, or difficulty breathing?
No.
Any fever over 100 degrees Fahrenheit?
No.
Any chills or shaking?
No.
Fatigue, muscle pains, or aches?
No.
Any diarrhea, nausea, vomiting, or abdominal pain?
Mm-hmm.
Okay. Any sore throat, runny nose, or headache?
No.
Any new loss of smell or taste?
No.
And what about any rashes or reddening of the eyes?
No.
Okay. All right. Well, you guys are all cleared to go in for your appointment.
Okay.
You're going to walk through the door, stand behind the rainbow line, and someone will check you in.
Sounds good. Thank you very much.
Thank you.
So as you can see there, Anne made sure to ask all the questions, different symptoms the patients could have. We also made sure to include symptoms that some children may have, but adults would not.
Emma Smith.
And your date of birth?
May 11th, 2007.
Perfect. All right. I need you to verify some information. I'm going to provide you with a tablet to verify that information. Okay? Okay. I'm going to put on my gloves and clean this out for you.
So what we normally try and do is the day before your appointment, we will try to call you to get this information verified ahead of time. In the event that we can't reach you or, you know, it's a bad time, we will supply you with a tablet. We will make sure it's clean, sanitized. We will hand it over to you. The goal is to make sure that you do everything from check-in to check-out in one location. So we don't want you hanging out in the waiting room too long. So almost immediately after you get your tablet, the next spot would be our medical assistant is going to come out and take you into the clinic space.
Emma?
Yes.
So as we see here, Sarah is bringing our patient and mother back. If you've been with our office before, you will notice that we are not going in our normal way that we would normally take patients in. Our goal is to try to eliminate, you know, just one access point. We want to try and, you know, use two instead, so that way we don't have patients kind of crashing into each other. You'll see later that our pulmonology patients will go in a different way because we want to try and separate our respiratory patients from our other patients. The goal is to make sure the patient and the parent never touch any of the doors, so you will be escorted in and out of your exam room. So you'll see here, Sarah's bringing them to the exam room. She will wash her hands, sanitize, and then put her gloves on and begin the vitals.
Just wash my hands, okay?
We always want to make sure that we verbalize everything so that you guys know that we are keeping ourselves clean and safe before we touch your child. We want to make sure that you guys feel safe and come back if you ever need anything. So one of the things that Sarah also mentioned in the video was to have the parent and the child stand one behind the other, so that way it's like a choo-choo train, and you guys go in in one behind the other and out one behind the other. If you've ever worked in a restaurant, this is very important so you don't crash into anyone else who has a big tray. And it's kind of similar here. We don't want too many people kind of interacting in the hallways. This is very similar to our first video where we're going to bring the patients back through the back door again and bring them into our clinic space for developmental and physiatry patients.
Nice to meet you. To see the doctor, okay?
All right.
If you don't mind, we're just gonna be walking in a straight file line to the right, so that we're not in the way of traffic, okay? How are you guys today?
We're good.
You
How are
good?
you?
I'm very good, thank you.
After you guys?
Okay.
So again, as you can see, they're going one behind the other and everyone is staying to their right. Sarah's making it a point to take a look in the hallway to make sure she's not going to come into contact with someone else. We're doing everything we can in our power to make sure everything is clean. So we have bleach wipes, sanitizing, and as you can see here, we have our cleaning staff coming in throughout the day to make sure the bathrooms, all the rooms, all the doorknobs, anything that's used throughout the day is cleaned throughout the day. We have upped our cleaning from probably about 2 times a day to about 5 or 6. This is all to keep everyone's clean and safe, and that way you guys feel comfortable coming into the office. So again, Sarah brings the patient back into the exam room. She was going to sanitize, wash her hands, and then she'll put her gloves on and administer the vitals. The last video that we're going to show you today is the pulmonology sort of intake. So as I said before, we have most of the patients are coming in through our back door, but we have our respiratory patients coming in another entrance, which is our regular entrance when you come into our office. So you'll see here we have our patient and our parent waiting, and you're going to see Chevelle come out and bring them in through that side door. This is the most direct route to get to our pulmonology respiratory lab and also to our pulmonologist, Dr. Kanengeiser. Again, as you saw, Chevelle told the parent and the child, you're going to stay to your right and then follow her in that way. Again, we want to avoid any patients, colliding with other patients or colliding with any of our staff to keep you guys safe. I can say that, we opened on Monday and we've seen this go really, really well. We've had patients say that they're very happy and they feel very comfortable coming here. Again, we're making sure that all of our doctors have 2 exam rooms, so that way we have ample time to clean each room in between each patient. We have bleach wipes, PPE. We are requiring all of our patients and their parents to wear masks when they come into the office. We're also limiting it to only 1 parent with the child and no siblings. And I know it's a little tough with all, with schools being closed, but it's just our way to keep you guys safe and our staff and other patients safe. So with that, I'm going to turn it back over to Dr. Quiros to end out our presentation.
Thank you, Angela. That was excellent. I want to thank all of you who attended. For those of you who are seeing these videos for the first time, we want to again thank you for your attention, and we want to welcome you to our clinic. We have a nice picture of the new hospital, the New Valley Hospital. Angela, you want to put it up? So there's a New Valley Hospital. The building to the right is the new Women's and Children's Pavilion. So as you can tell, we're expanding our services, and this area is right in front of where our current clinic space is. And we're aiming to become a health destination in New Jersey. We thank you for your patronage. We thank you for allowing us the privilege of taking care of your children and your loved ones. And please don't hesitate to contact us if you have any questions. Again, thank you, and we will see you here at Valley.